Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Opportunistic infections. So here in opportunistic infection, first we'll look at the toxoplasma. So the toxoplasma, it is nothing but a bilateral. It is bilateral and there is a basal ganglia which is involved. It is a ring enhancing lesion with the eccentric target sign. So ring enhancing lesion with the target sign appearance. Then comes, so we look at the cryptococcosis. Cryptococcosis, it has a prominent soap bubble appearance which is seen. Then looking at the lymphoma. The lymphoma is associated with the EBV, that is Epstein-Barr virus, and the periventricular enhancing lesion is what is very prominent here. Periventricular enhancing lesions are seen. To learn and grow daily like this, please do subscribe.